Welcome to the Dental Pro Tech Talk, the ultimate show for dental professionals staying on the cutting edge of dentistry and technology. Join us as we explore the latest advancements in dental tools and techniques, from soft tissue diode lasers and teeth whitening to imaging breakthroughs and beyond. We're here to help you future-proof your practice and deliver exceptional patient care. Whether you're a dentist or hygienist, this podcast is your go-to resource for tips, growth, and all things tech.
Welcome back to Dental Pro Tech Talk. Today we're doing a deep dive into soft tissue diode lasers and how they can be used in restorative dentistry.
Yeah.
And for this, we're looking at a webinar by Dr. James Braun.
Right.
He's a prosthodontist with over 30 years of experience.
Wow.
You might recognize him from the ADA CERP Advisory Board or as one of Dentistry Today's top clinicians.
Oh, yeah. Dr. Braun, he's a well-known and respected guy.
Yeah, for sure.
I think what's really interesting is that he used to be a huge fan of electrosurgery, but in his webinar, he talks about how he completely changed his mind about lasers.
Yeah, it sounds like he really had a change of heart. So let's get into it. Can you give us a quick rundown on how diode lasers work for those who might not be familiar?
Sure. Diode lasers use a fiber optic tip to emit a really focused beam of light.
Yeah.
And that light creates heat, which vaporizes the tissue.
So it's not like electrosurgery where there's an electrical current going through the patient.
Exactly. It's a lot less invasive, so patients heal faster and have less discomfort after the procedure.
That's great.
Yeah. And Dr. Braun talks about how much less patients complain about pain after he started using lasers.
Makes sense? Less pain, happier patients.
Right. And it can even mean fewer calls back to the office.
Oh, that's a huge plus.
And there are other benefits, too, like when it comes to specific restorative procedures.
Yeah, let's get into that. What kinds of procedures did Dr. Braun highlight?
He focused mainly on the common stuff, like crown preps, composite fillings.
Especially class 5s.
Yep, especially those.
The ones right near the gum line.
Yeah, those can be tricky.
Definitely. And what about post and core buildups?
He talked about those too.
Okay, so what are the advantages of using lasers for those kinds of procedures?
Well, the big thing is that it creates a really clean, dry field. No bleeding, no contamination. It really helps to make those restorations more predictable.
Yeah, I can see that.
And he showed some really amazing before and after photos from his own practice.
Yeah, those were impressive, especially the ones where you had subgingival margins or soft tissue in the way.
Exactly. Think about those tough crown preps.
Oh, yeah.
Where you're constantly fighting bleeding and having to retract the tissue.
It's a nightmare.
The laser gets rid of all that.
Yeah.
It gives you a clear view and makes it so much easier to get a good margin.
So it's all about working smarter, not harder.
Right.
And speaking of working smarter, Dr. Braun also talked a lot about efficiency.
Oh, yeah.
He said he can often complete procedures faster and sometimes even in just one appointment.
Which is great for both the dentist and the patient.
Right.
The dentist saves chair time and the patient spends less time in the chair.
It's a win-win.
Definitely. But I'm sure some people are wondering if those lasers are easy to use.
Yeah, are they user-friendly?
That's right.
Is there a steep learning curve?
Well, those are good questions.
Because I know a lot of dentists, including myself,
Yeah.
we see these lasers at conferences and we wonder if they're really worth the investment, both the cost and the time it takes to learn how to use them.
I get it. But Dr. Braun actually addressed that. He uses the AMD Picasso laser, and he said it has a really user-friendly touchscreen interface. He said the tip activation is simple, and it even has a wireless foot pedal for control.
Oh, that's cool.
It's very convenient.
But what about safety?
Yeah.
It's a laser and it's going in a sensitive area like the mouth.
Right.
I'm sure a lot of dentists are wondering about potential hazards.
Yeah, like what precautions you need to take.
Exactly.
Well, Dr. Braun said the safety precautions are actually pretty minimal.
Okay.
You need proper eye protection for you and the patient.
Of course.
And of course, you have to follow the usual OSHA signage requirements.
Right.
But one thing that people often worry about is metal in the mouth.
Oh, yeah.
Like if a patient has a PFM crown or an implant.
It's always a concern with electrosurgery.
Right, because you have to worry about arcing and sparking.
Exactly.
But with a diode laser, there's no electrical current involved, so there's no risk of that.
So it's safer around metal.
Yeah. Dr. Braun said he's used it around PFMs and implants without any problems.
Okay, so that's reassuring.
Yeah.
So let's say you've decided to invest in a diode laser. What tips did Dr. Braun share for getting the best results?
He gave some good advice.
Like what?
Well, for example, he usually sets the wattage between 1.7 and 2.
Yeah.
And he adjusts it depending on how thick the tissue is and how keratinized it is.
Okay.
The goal is to avoid charring or scalloping.
Yeah, you want those smooth borders.
Right, for optimal healing and aesthetics.
It's all about precision.
Exactly. Did he talk about pain management?
Yeah, he did. And this is where it gets interesting.
Oh,
He prefers to use a ligajet for anesthesia.
really? Instead of a traditional inferior alveolar nerve block?
Yep.
That's fascinating.
Yeah, I'd love to learn more about how that works and why he likes it so much.
Me too. Sounds like Dr. Braun's always on the cutting edge.
He is. He's always looking for ways to improve and give his patients the best experience.
So it seems like diode lasers have a lot of uses beyond just restorative dentistry.
Yeah. Besides crown preps and fillings, what else did he mention?
He briefly talked about treating aphthous ulcers,
Uh-huh.
and he also mentioned gingivectomies and even frenectomies.
Wow. It sounds like a really versatile tool.
It is. It's like a multi-tool for soft tissue procedures.
No wonder there's so much buzz around diode lasers. They seem to offer a lot of potential.
Definitely.
Okay. But let's get back to Dr. Braun's main focus,
Right.
which was the impact of lasers on restorative dentistry.
Yeah. What are the key takeaways for dentists who might be thinking about adding this technology to their practices?
Well, based on what we've discussed so far, I think the big advantages are improved access,
Okay.
especially for those hard-to-reach areas.
Right.
You also get more predictable outcomes, increased patient comfort, and of course, there's the boost in efficiency for the practice.
Working smarter, not harder.
Exactly.
Mm-hmm.
And you know what else really stood out to me? Dr. Braun's enthusiasm for this technology.
Oh, yeah. You could really hear the passion in his voice.
It was contagious.
It makes you want to try it yourself.
Definitely. And I think that's a key takeaway from this deep dive so far.
Yeah, it is.
It's not just about the technology.
Uh-huh.
It's about being open to innovation and always looking for ways to elevate patient care.
Right.
And, Dr. Braun was very upfront about some of the potential downsides of diode lasers, too.
Oh, yeah. What did he say?
Well, he acknowledged that getting those perfectly smooth borders takes practice.
Oh,
And it also takes a good understanding of how different tissues respond to the laser.
that makes sense.
It's not a magic wand. It takes skill and finesse to use it. Before you start using it on patients, you really need to get to know your laser and its settings.
Of course.
It's all about patient safety and predictable outcomes.
So training is key.
It is.
And of course, there's the cost of the laser.
Yeah, let's talk about that.
It's a big investment for any dental practice.
Definitely. And I'm sure a lot of dentists are wondering if it's really worth it.
Yeah. Do the benefits justify the price tag?
Well, Dr. Braun addressed that directly.
And what did he say?
He said that while the initial cost is high, the long-term benefits can make up for it, both clinically and in terms of practice efficiency.
Uh-huh.
He really emphasized the potential for increased case acceptance.
Oh, interesting.
Yeah, if patients know they'll have less pain and faster healing, they're more likely to say yes to treatment.
Right. That makes sense.
And that means a happier patient base and potentially more revenue for your practice.
So it's not just an expense, it's an investment.
Exactly.
Yeah.
What do you think about the cost-benefit analysis of diode lasers?
That's a good question. What would you consider before buying one?
Well, first I'd look at my current needs and procedures.
Okay.
Do I often have cases where a laser would be a big advantage?
Yeah, it doesn't make sense for your practice.
Right. And then I'd think about how it would affect my patient flow and my overall efficiency.
And you'd have to factor in the cost of training and maintenance?
Oh, yeah, for sure. It's an ongoing commitment.
Definitely.
And I think it's important to be realistic about how long it'll take me to learn how to use it.
Yeah. Are you comfortable with new technology?
Exactly. Are you willing to put in the time to master it?
Good point.
It's a lot to consider.
It is. But for dentists who are ready to embrace innovation and take their practices to the next level, I think diode lasers offer a lot of potential.
I agree. And one thing that Dr. Braun talked about that I thought was really important was patient perception.
Oh, yeah.
Not all patients are comfortable with the idea of lasers.
That's true. Some people might have preconceived notions about them.
Or even fears.
Yeah, maybe from movies or something.
It's almost like a Hollywood effect.
It is.
But it's our job as dental professionals to educate our patients.
Right.
We need to explain this technology to them.
And demystify it.
Exactly. How does Dr. Braun approach that?
Well, he said he takes the time to explain to patients how the laser works. He emphasizes that it's gentle and that it will help them heal faster and with less pain.
I like that.
Yeah, and he uses a great analogy.
What is it?
He compares the laser to a soft tissue handpiece.
I like that. That helps patients visualize it.
Right, it makes it less scary.
Did he have any other strategies for dealing with patient concerns.
Yeah. He also said it's really important to show patients before and after photos,
Oh, yeah. That's always helpful.
especially of cases that are similar to their own.
Right.
Those visuals can be really powerful
They can really help patients see the benefits.
and address any doubts they might have.
It's all about building trust.
Exactly.
So I think a key takeaway for our listeners is that communication is essential.
Definitely.
If you're going to use a new technology like a diode laser, take the time to explain it to your patients,
Sure.
answer their questions, show them how it can benefit them.
Good advice.
So we've talked about a lot of the applications of diode lasers for restorative dentistry.
Yeah, crown preps, fillings, and so on.
But I know that a lot of our listeners are probably curious about those other applications too.
Oh, yeah. The ones he mentioned briefly.
Yeah, like affess ulcers, gingivectomies, and frenectomies.
It's amazing how versatile these lasers are.
They really are.
Yeah.
But to be fair to Dr. Braun, he did say up front that his webinar was going to focus on restorative applications.
That's true.
He probably didn't want to overload people with too much information.
Right.
So for our listeners who are interested in learning more about those other applications,
Yeah.
we do have other deep dives that cover things like laser-assisted periodontal therapy
Uh-huh.
and soft tissue surgery
Okay.
and even pain management.
So yeah, let's stick to diode lasers and restorative dentistry for now.
Okay, so one thing that really struck me about Dr. Braun's presentation
Yeah.
is his enthusiasm.
Oh, yeah. It makes you want to see how these advancements could change your own approach.
Definitely. It's a great example of lifelong learning in dentistry.
Always something new to discover and to integrate into our practices.
Right. But it's important to remember that what works for one dentist might not work for another.
Yeah, Dr. Braun's experiences might not be universally applicable.
It's a good point. Every dentist has their own way of doing things.
And their own patient population.
Right.
We can't just copy someone else's methods without thinking about it carefully.
He even mentioned that he prefers titanium posts over fiber posts in some cases.
Oh, yeah. That's a debate that a lot of dentists have.
There are good arguments on both sides.
Definitely. The important thing is to stay up to date on the latest research
Yes.
and to understand the pros and cons of different materials and techniques.
Absolutely.
And then you can make the best decision for your patients.
It's all about critical thinking and evidence-based practice.
Right. We can learn from Dr. Braun, but we also need to use our own knowledge and judgment. Oh, and he also talked about the importance of working with a quality dental lab.
Yes, especially when you're using lasers for restorative work.
He stressed the need for precise margins and clear communication with the lab.
To make sure those restorations fit well and look good.
It's a team effort.
Absolutely.
The dentist and the lab technician have to work together.
When everyone's on the same page, the patient benefits.
So true.
Okay, so before we move on, I want to mention one more thing that Dr. Braun talked about during the Q&A.
Okay, what's up?
He mentioned using ease-in shields for eye protection.
Oh, yeah.
When you're using a laser with loops.
I remember that. It's such a good idea.
It is. For those of us who use magnification.
It's a game changer.
No more fumbling with safety glasses over your loops.
Or constantly switching back and forth.
It makes everything so much easier.
It really does. It's those little innovations that make a big difference in our day-to-day work.
So as we wrap up this part of our deep dive, what are the key takeaways for our listeners?
I think it boils down to this.
Okay.
Diode lasers are precise, efficient, and they make things more comfortable for the patient.
Right.
They can be a really valuable tool for any restorative dentistry practice.
But like any technology, you have to use them thoughtfully.
Yeah.
And as Dr. Braun's story shows,
Yeah.
it's never too late to try something new and transform your practice.
So as you go about your week, think about your own practice.
Are there areas where technology could make things better?
More efficient, more precise, more comfortable for your patients.
Maybe it's time to step outside your comfort zone, do some research, and see how innovation can shape the future of your practice.
I think that's a great challenge for our listeners.
Okay, so now let's shift gears a little
Okay.
and talk about some of the practical considerations of using diode lasers.
Sounds good.
We've talked about the benefits and how they can change patient care,
Yeah.
but there are always logistical things to think about too.
Like what?
Well, one of the first things that comes to mind is training.
Uh-huh.
It's not enough to just buy a laser and expect to be an expert right away.
Right.
Dr. Braun really stressed the importance of training.
Yeah. You need to get to know your laser and how to use it safely.
Exactly.
Okay.
So what did he recommend?
Well, he said to start with simpler procedures
Okay.
to build up your confidence.
Makes sense.
And then you can gradually do more complex things as you get better.
Right.
He also suggested going to hands-on workshops or courses.
Oh, that's a good idea.
Yeah, that way you can learn from experienced clinicians.
Hands-on training is so valuable,
Definitely.
especially when it comes to technology and patient safety.
And he said to practice on extracted teeth or models before you try it on a live patient.
Okay.
That way you can get a feel for the laser's power.
Yeah, and how different tissues react.
Right.
Those are some great tips.
I think so.
And don't forget about continuing education.
Oh, yeah, that's important.
Technology is always changing.
New techniques and applications are coming out all the time.
It's true.
If you want to stay ahead of the curve, you need to keep learning.
Absolutely.
Yeah.
Conferences, online resources, it's all important.
Okay, so let's talk about another practical consideration.
Yeah.
Maintenance.
Oh, yeah, you have to take care of your laser.
It's a sophisticated piece of equipment.
It is.
You have to maintain it properly if you want it to last.
And to work properly.
Right. So what did Dr. Braun say about maintenance?
He emphasized the importance of following the manufacturer's instructions
Okay.
for cleaning and disinfection.
Right, just like any other dental instrument.
And he also recommended regular inspections and calibration.
To make sure the laser's working the way it should.
Yeah,
and
right.
don't forget about eye protection.
Oh, yeah, that's crucial.
Laser light can damage your eyes.
You're both the dentist and the patient.
Yes, you have to be careful.
What kind of eye protection did he recommend?
He said you need eyewear that blocks the specific wavelength of light that your laser emits.
Okay.
And he mentioned those ease-in shields that we talked about earlier.
Right. Those are so convenient for people who use loupes.
Definitely. Okay, so before we wrap up this part, I want to talk about one more thing.
Okay.
Communication with your team.
Oh, yeah, that's essential.
If you want to use a new technology, like a laser, successfully,
You need buy-in from your whole team.
everyone needs to be on board.
Your assistants,
Yeah.
your hygienists,
Yeah.
your front office staff. What did Dr. Braun say about team communication?
He said it's important to involve your team from the beginning.
Okay.
Let them know why you're considering a laser, what benefits you expect, and how it will affect their jobs.
That's a good idea.
It gives them a sense of ownership.
And it makes them more likely to embrace the new technology.
Exactly.
Yeah.
He also recommended providing thorough training
Uh-huh.
on how to use the laser safely and how to assist with laser procedures.
Everyone needs to know their role.
Right. And they need to feel confident using the laser.
And don't forget about ongoing communication.
Oh, yeah. You need to keep the conversation going.
Regular team meetings can be really helpful.
Definitely.
They answer questions, address concerns,
Yeah, tips and tricks.
and celebrate successes.
It's all about creating a culture of open communication and collaboration.
Exactly.
Yeah, it's amazing how fast things change in dentistry.
I know, right?
Like electrosurgery used to be the gold standard for soft tissue management.
Yeah, and before that, it was all scalpels and sutures. So, yeah, we've come a long way.
Technology just keeps moving forward.
There's always something new. Exactly. We need to make evidence-based decisions,
For sure.
ones that support our own individual approaches and our patients' needs.
That's where Dr. Braun's story comes in.
He explored the potential
And then he integrated it into his practice in a way that made sense for him.
in a way that aligned with his commitment to excellent patient care. And I think that's a great lesson for all of us.
It's not just about the specific technology.
Right.
It's about having the right mindset.
The mindset of continuous learning, always adapting, and always looking for ways to improve.
I love that.
So as you go through your week, think about your own practice.
Okay.
Are there places where technology could make things better?
Hmm.
Maybe you could be more efficient.
Oh, more precise.
Maybe you could improve patient comfort.
Yeah. Maybe it's time to try something new.
Step outside your comfort zone.
Do some research.
See how innovation can shape the future of your practice.
That's a great challenge.
So to sum up, we've talked about the benefits of diode lasers,
The practical things to consider.
the importance of training and communication.
And the fact that they're not a magic cure.
Right.
They take skill and practice.
But for dentists who are ready to embrace innovation,
Yeah.
diode lasers can be a great way to improve patient care.
And change the way we approach restorative dentistry.
I completely agree. It's really amazing to see how technology has changed our profession.
I know, right?
Just think about the past 10 years.
Wow.
Digital dentistry, 3D printing, and now lasers. They're becoming more and more common. And it just shows that we can never stop learning.
We have to keep up with the times.
You'll know if a laser is right for you,
And remember, you don't have to figure this out on your own.
right?
Talk to your colleagues.
The ones who are already using lasers,
Go to conferences.
do your research.
Gather as much information as you can.
And don't be afraid to ask questions.
That's how we learn.
So if you're curious about diode lasers,
Yeah.
Or if you want to hear different perspectives,
Reach out to us.
you can find us on our website.
Our social media channels.
We're always happy to hear from our listeners
We'd love to share our insights.
and help you navigate the world of dental technology.
So keep learning, keep exploring.
And never stop striving for excellence.
Thanks for joining us on this deep dive into diode lasers and restorative dentistry.
We'll see you next time on Dental Pro Tech Talk.